like lockdowns and travel bans. According to the Uganda Virus Research Institute, human metapneumovirus was discovered in the Netherlands in 2001 and is not a new virus. In Uganda, cases of the virus were previously detected in 2013, suggesting some level of existing immunity in the population due to past exposures.
One of the studies we did in 2013, we found that among those who come to our centers with such illnesses, about 1.5% had this virus. It's one of those causes of cold, cough, flu. When it gets serious, you get pneumonia.
Over 20 years, we don't have evidence whether it has significantly changed, but runs a seasonal course in China, and China has been always able to control it, much as the spikes come, specifically during the cold season.
Addressing concerns about potential risks posed by travel between Uganda and China for business and other purposes, Ministry of Health says that the current situation does not warrant panic and there is no need to worry.
We know what is going on. We need to watch. If there's anything to worry about, we're going to inform people. But I want to really allay the fear among people. It's unlikely this will be like COVID. COVID was a new infection. We didn't have any immunity to this new virus, but this is not the case. This is a virus that has existed, but it has increased in some populations. So we are going to watch out.
According to the Ministry of Health, there are no plans to impose travel restrictions, but advise travelers to affected areas in China to take necessary precautions.
No. We don't talk about any lockdown, not even in the immediate. For travelers who travel to some of these places, we have to appreciate the symptoms, possibly take these measures and ensure that you don't get exposed. We don't have any recommendations for travel restrictions yet, as of now.
I don't think you should worry people for now, scare them from traveling to China or Japan or India. In the case with this, because one of the ways of seeing that there's a problem is when you see a surge, an increase in infections in children, pneumonia. Sometimes they affect those who have asthma and the rest. You start detecting those, then it gives us some suspicion and we start testing. I think for now, we should remain calm and just watch the situation.
The routine surveillance will continue, but Uganda Virus Research Institute says attention has to be drawn to the fact that viruses can mutate.
Of course, more needs to be done because, as you know, viruses change, they mutate. So those who are doing the sequencing of the virus to look at it, they will have to check, has it changed a bit to become more transmissible and cause more severe disease? Those are all the things that now needs to be done. For the scientists to look at it, is it the same virus or has it changed a bit?
Unlike 5 years ago during the onset of COVID-19, Ministry of Health officials say that Uganda is better prepared to handle any potential outbreaks.
The detection capacity is much higher, is much faster. The response mechanisms remain. That is on detection, but also in terms of care components. The health workers, we have a bigger pool of health workers who are trained and who can be able to manage patients.
Norbert Atkunda, NTV Tonight.
This is going to change drastically. Seasons and times. Abantu abalimi mwegendereze seasons zigenda kukyukira ddala. Enkuba bwegenda okutanyanga nyingi naye nga si ya lwezo. Naye ng'enkuba ntono yegenda okubeera olwezo. Seasons are going to change because man has adapted nature. Man has destroyed nature. Therefore, climate is going to change. And the change of climate is going to bring cracks. Cracks. Mumataka. Ojatuka watungora betaka. Sina Uganda yuka. Nense de sewe Asia wherever. Ojakulanga cracks. Ngoniso gambe taka. Ese yonde na konachi. Kubira. Walola byeka nyumba da zitambulira waggulu ettaka nga litambula nga zigenda ng'ennyumba zigenda ettaka litambula linda mujja bireetera wano ojja kulaba nga bitambula ebitooke bitambula biri ku ttaka bitambula obadde ovuga motoka y'ovuga motoka olwabasajja etandisa okutambula you lost control bajja bibawa just be vigilant. Just be vigilant.
Rescue workers in Tibet are working round the clock to search for survivors after a major earthquake killed at least 126 people. The magnitude 7.1 quake struck at around 9 a.m. local time on Tuesday. The impact was felt across the Shigatse region of Tibet, although tremors were also felt in Nepal and parts of India. A large-scale operation has been launched with survivors under additional pressure as temperatures as low as -16 degrees Celsius. Chinese state media reported that around 3,000 buildings had been destroyed, leaving thousands of people without shelter. Residents are afraid to enter some buildings left standing as aftershocks continue. Well, earlier I got the latest from exiled leader of the Tibetan government, Pempa Tsering.
The only source of information is the Chinese government agencies, whatever they report. So it's very difficult to verify the number of casualties of people who have succumbed to injuries, people who are injured, how many have been taken out of those places for medical attention. So all these information are still not very clear because we do not have direct access to information inside Tibet, apart from families who are reaching out because it's very close to Nepal, and many families in that region also lives in Nepal. So that is also one source of information for us, but otherwise it's very difficult to confirm. And the weather conditions, as you can imagine, the earthquake where it happened, the epicenter, Tingri, and the surrounding areas of Tingel, Hase, Sakya, Nyalam, and Amrim. These are other smaller localities around that. All are at an elevation of more than 4,000 meters above sea level, which should be about 14,000, 15,000 feet above sea level, and temperatures go minus degrees around this time of the year. So people are having a lot of problem having to be relocated, and some more than 30,000 people have been relocated so far, it seems, according to government agencies of the Republic of China.
And of course, you live in exile away from Chinese rule there in Tibet. But what do you make of the Chinese government's response so far to this earthquake? Of course, I understand you have limited information at the moment.
It looks like there is the government has sent in or making good enough effort to save people's life. And a lot of local Tibetans also from the surrounding areas, and also Muslim communities are also coming together to provide shelter and food for people who are surviving. So it looks like everybody is putting in their concerted effort to save people.
And of course, this is an area that is prone to earthquakes. There are other environmental challenges. What do you think the long-term considerations for this part of Tibet are going forward?
As we all know, the Tibetan plateau came out of the tectonic shift between the Indian plate and the Eurasian plate, and there is a big fault line. And the whole area is very prone to earthquakes, and it's very seismic zone. So I think this is a nature's call to warn the Chinese government about developing mega projects like what they announced last month, mega dam on the Yalung Sambo or the Brahmaputra River, which becomes Siang in India. The mega dam is supposed to produce 3 times the hydroelectricity than the Three Gorges Dam, which is the biggest in the world. So the whole area is seismic zone. If something happens to that size of a dam, what could be the severe consequences in downstream countries is somebody for everybody to imagine.
And that was Pempa Tsering, exiled leader of the Tibetan government.